Okay, so I wanted to make this update. I promised everyone that I was going to do an update every week on the effects of Lupron and everything that I was going through. I'm sorry for everybody. I didn't follow up on that at all. Too much happened. It just became really rough and hectic and crazy at the end that I just could not film a video. Now, don't anybody take that the wrong way. I don't mean to scare anybody. Okay, so it first started, I was supposed to have 6 months of a Lupron injection. So I started my first shot when I did my last video, and it took my body like 2-3 months to respond to it because I was still having some bleeding and stuff. So because of that, we had to add on another injection. So I was on it for a total of 9 months, which things got really bad at the end. My second to last shot, I don't know if maybe the nurse didn't mix it right or something. I don't know, but it was just completely different than the first and the last one. The middle one was absolutely horrible. I had severe headaches to the point where I can't even explain it. It was just absolutely horrible. Not even headaches, not even migraines. It felt like my brain was like bleeding or something. It was just really bad. So when you're on Lupron, you can't take anything. You can't take Advil, stuff like that. Because there's an interaction, you'll have a heart attack. It messes up your QT interval timings. So anyway, every time you got a headache, or I got a headache, I had to call the doctor, and I had to then go to the emergency room because Lupron does cause bleeding of the brain. That is a side effect that rarely can happen, but it happens. So they would not prescribe anything until I went to the hospital to have CAT scans done to make sure there was no brain bleeding going on, which was a little scary in itself. That being said, I had to leave work early a lot of days. Some days I didn't make it to work. Work was just really rough. I worked with all guys, which was even rougher because no one understood what I was going through at all. It was just really hard. So I remember one day, me and my husband were actually on our way to the Greek festival here in New Jersey, and we didn't make it. We pulled over like 10 minutes before we got there. My headache started, and I was just like, okay, maybe it'll just go away. And it was horrible. We pulled over in a park, and I was hysterically crying, throwing up. I couldn't move. Like, I just remember grabbing my head and just screaming and hysterically crying. I couldn't deal at all. I really thought I was dying. He's like, I have to take you to the hospital. I'm like, I'm not going to make it to the hospital. Like, I'm really bad right now. We went to the hospital. From being in the hospital so much at that point, on and off, and being there all night long, and it was just tiring. I just didn't want to do it anymore. We sat in the parking lot for like 15 minutes, and I was like, let's just sit here. And things calmed down a little bit, and we went home. I did not go in the hospital that night. I couldn't. So that happened. The next shot after that, things kind of leveled off a little bit. Right before I did the next shot, my 9-month shot, my doctor asked me if I had wanted to continue. Being that most people don't have every side effect of the Lupron, I did. I had every bad side effect that there was. I'm not going to sugarcoat it, but I will say this. If you have endometriosis and you are in a position that you want to have children one day, or you have children, whatever it may be, I highly recommend it. I know there's a lot of things out there about the Lupron and these lawsuits and all this stuff going on, and I'm not saying it wasn't rough and it wasn't hard a lot of days. And no one seemed to know what I was going through. My husband was there for me, and he was supportive and stuff like that, but it got really hard at times. He lost his job. I was the only one bringing in money, and I was on the Lupron, and I was sick every day. It was a really big struggle. It was really hard. It just felt like no one was in my corner. I couldn't even explain what I was going through. No one understood. So the next thing was, I did quit my job. My job of 7 years. I had to leave. And it kills me to this day, but I just had to do what I had to do. I couldn't handle any more of it. I literally had to walk away. I'm currently still not working. So right now I got a lot of stuff going on, and everything's good. My husband's working. He's letting me take a lot of time off, trying to kind of figure out what I want to do right now. Somebody asked me about hot flashes. on my email. So sorry, I'm really sick. I was sick for the past 3 days, so I'm just kind of getting over it. Some of my voice is different. I'm really, really congested. Hot flashes. They were severe. I mean, they were really bad. But I have to say, after the Lupron, I had hot flashes before the Lupron, just because of the bleeding and the hormone issues and everything going on. But I have to say, after the Lupron ended, I have never had another hot flash since. I guess everything just kind of leveled itself out, and that's how you know that something is going on with your body that's not normal. So I have to say I'm so much more comfortable. I do get hot now, but it is not like how it used to be at all. So that was my Lupron experience. My next experience, in case some of you didn't look at my channel and see my last video that I updated, I came off the Lupron. I had one cycle in December. My period started. I gained a little weight from the menopause. I am usually like 120. I shot up to about 145. I liked it. I loved it. But the doctor didn't understand how I gained it so fast, because I literally gained it in like a month. The last month of my Lupron, I gained it. I just shot up. And he didn't understand why it was happening so fast. So I had to go for an ultrasound, and I had to, if that came back normal, I had to see if there was like a problem going on with my bowels or fluid in the stomach, stuff like that. So I went for the ultrasound. Everything was perfect. He said that he cannot believe how well the ultrasound looked. It was one of the best ones he's ever seen. The uterus lining after the Lupron had just thickened up so much. It was just perfect. Everything just took so perfectly. So I asked him about having children, because me and my husband want to have kids. And we've kind of waited. We wanted to wait like another 6 months to a year. And I had asked the doctor what his opinion was on that on my last visit, which was December 28th. And he said, do it now. You've just gotten treated for endometriosis. Endometriosis does come back. Yes, Lupron does put it in remission, but nothing's guaranteed. So if you've just been treated and you want to have children, do it then. If you're thinking about doing Lupron and you have endometriosis, then I would see what the chances are of you becoming infertile by the time you are ready to have children. So if you don't want to have children for a year or 2 years, then I would go to your doctor and talk to your doctor and ask him and tell him what your plan is, that your plan is for a year or 2 years to have kids, and what he recommends. If you should do the Lupron now, if it'll stick, if you'll get the endometriosis back and have to do it all over again, or should you just wait like 6 months, go on a 6-month shot, and then have children as soon as you're done treatment. If you can do that, I would highly recommend it. So I went for the ultrasound December 29th, and everything was great. So that was good. That felt really good for once in my life. So I got my cycle. Then I didn't get my January cycle, and I just kind of thought like, okay, you know, it's just the doctor told me it's going to take a few months to kind of get my body back on the cycle and stuff like that. I might skip periods for the beginning and stuff like that. Here, I found out after we started trying, I got pregnant 2 weeks later. So we are now pregnant. I am now 23 weeks, going on 24. And it's been fantastic. So, yeah, there was a lot to the bad side effects of Lupron, but if this is what you want in your life, then I recommend doing it. It was worth every side effect. And yeah, there might be problems down the line. I don't know if there's any now. The one thing I have to say is I do have severe memory loss from the Lupron. I don't remember anything like I used to. It's bad. Like, things that I used to cook, I can't even remember how I made them. And I just don't remember anymore. So that is a huge side effect that I think I'll always have from the Lupron. As far as muscle pain, joint pain, things like that people have, I don't have that at all right now. I haven't experienced that. But who's to say it won't come down the line? But then again, when you have that child, it's like, is the joint pain worth it? Yes. So that's the question you have to ask yourself. It's just how bad you want it. And it's going to be hard. And if anybody has any questions or problems or just wants to talk about it or is just having a rough day, send me a message. And, you know, you can get through it. It will pass. And just remember all the hell you've been through for however long. I mean, I was going through it for 10 to 15 years. And it's just nice to see that finally I have a big break from it. Since I became pregnant, the doctor said, don't get pregnant to treat your endometriosis. But if you get pregnant and you have endometriosis, it is another 9 months of treatment, which is fantastic. So you do the Lupron for 9 months, then you become pregnant, and when you're pregnant, your endometriosis stops. So that's another 9 months plus 9 months or 6 months, however long you're taking the injections for. But still, that's a good amount of time, which is far better than any chances if when we had, laparoscopies and all those other things, and, they scraped the endometriosis off as much as they could. It can come back in one cycle. My doctor has told me one cycle for a woman is a lifetime. It's not just 28 days or however long, 30 days your cycle is in intervals. It's a whole entire lifetime to a woman's body. So anything can happen. Anything can change. When I got pregnant, I developed a cyst on my ovary, which I got kind of worried about. However, usually what they said happens is it will burst by the 13th week, which it did. Thank God. And because I was like, here we go again, ovarian cysts all over again. I already had like 5 surgeries for these. So, but it did burst, thank God. And what happens is when you become pregnant, the ovary that you ovulate from will form a cyst on it. So we found out the right ovary was where I had the cyst, and that is most likely where the egg had dropped. So, lucky me. But the ovary's not gone. The cyst is gone, so thank God. So, that's my update. Look at my gender reveal video. It came out perfect. It was the best day of my life. It was so emotional, yet it was just great. Check it out. I will update everybody now, I guess, about the pregnancy, the symptoms I'm going through, which was very rough in the beginning. So I won't spoil what the gender was. Everybody check out the video. And I'm really happy I got to make this video. And I'm sorry again for anybody that I did not update like I said I was going to. But I wanted to do this because I'm getting a lot of questions and I want to be there for you girls. So good luck. Let me know how everything works out. Bye, guys.